Hello. To say that 95% of the world population, including doctors and nurses, breathe wrongly is quite a big statement. But I don't say so lightly. When I came across that statement about 15 years ago, I was shocked because by then I had worked as a nurse and a teacher within the NHS for over 25 years. So you can imagine my reaction. As such, I set off to research into respiration, mainly to prove that it was a mistake. But to my greatest disappointment, it turned out to be true. I hope that by the end of this video, you'll be able to understand what it means to breathe correctly or incorrectly. And by just looking at someone, you will be able to tell whether he breathes correctly or not. Of course, during this time with the COVID-19, doctors and nurses won't be very happy to hear that they too breathe wrongly. In fact, the medical profession doesn't like their apple cart to be upset. Anyway, breathing should be a simple act. Inhale, you breathe in. Exhale, you breathe out. That's true only if you do it rightly. Generally speaking, people aren't really interested when I say respiration because they aren't aware of the enormous benefits a good respiration can bring. We all know that breathing is synonymous to living. Therefore, we can say that the quality of our life depends upon the quality of our respiration. Everyone, including health professionals, assume that we breathe well, but sadly we do not. Breathing incorrectly impacts negatively upon our health. If you look around, you'll see that the world is full of diseases, be it in the form of physical, mental, emotional, and social ailments. In fact, only babies breathe well. They do so instinctively and naturally. That is, according to how Mother Nature intends us to breathe. And they do so until about the age of 6. If you observe how a baby breathes, you'll see that its little tummy moves in and out. This is known as abdominal breathing. Although its lungs are tiny, it uses them efficiently, that is, to their full capacity. And you may have noticed that babies are always jolly and lively. Then we take a look at how an adult breathes. He does exactly the opposite to what a baby does. He lifts and lowers his chest and his shoulders. This is known as chest breathing and is incorrect. When we do so, we use only about 35% of our lung capacity. It wouldn't be so bad if we expect only about 35 performance from our job, work, etc. But we expect 100%. There is the problem. Say you have a bank account and You deposit 35 pounds in it, but withdraw 100 pounds every single day. You'll eventually be bankrupt. But we do so with our body. We input 35% of air, and then we want to perform very well in whatever we do. So eventually we get bankrupt. That is, we end up with a heart attack, cancer, or a mental breakdown. And you must surely have heard of many people going through that. So what's the difference between chest breathing and abdominal breathing? Well, if we look at the anatomy of the chest cavity, we'll see that we have 12 pairs of ribs. The first 10 pairs are attached in front to the sternum and to the back with the vertebral column, the spine. And then you have the last 2 pairs that are attached only to the spine at the back, and they are free-floating in front. That's why they are known as floating ribs. This is to allow movement during respiration. So the rib cage is strong and it's fixed, which means it cannot move and expand because ribs are solid. Structure is always related to function. This means that every organ in your body is made according to the function it has to carry. Unfortunately, the majority of people do not really know how their body functions. One cannot be expected to stay healthy if one doesn't have a clue as to how his body functions. Now, if we look at the respiratory system, we can see that air moves through the airway into the lungs. It doesn't actually come out of the lungs. So air comes in and out. The air is contained only within the respiratory system. You will notice that there is no attachment, no connection whatsoever between the lungs and the shoulders or the top part of the chest. So it's important to note that air is not flowing around here, only within the lungs. So, why do people raise their chest and shoulders when they breathe? It's because they use the only top part of the lungs to breathe, and that as they inhale and the air reaches the top part of the lungs, they use their lungs from this part up, and as the air reaches the very top, there's no more room for air to enter. So what they do is they lift their shoulders and the top of their chest. So if you put your hand on your chest and consciously feel as you're breathing, most probably you will feel your hand move up and down. And you should feel some tension within your chest. If you look at me breathing now, you won't really see me moving my chest up and down. It doesn't mean that I'm not breathing, of course I am. But it's just that I'm using the lower part of my chest, that is my abdomen, as babies do. Now, if you were to take a deep breath, try and take a deep breath with your hand still on your chest. You will feel how your hand moves up even further and your shoulders move up. This really creates more tension within your chest. Try and feel the breath as it goes in. So taking a good breath, a deep breath, really doesn't do any good to you. Now, if we look at how many times we breathe per minute, people don't really know when I ask the question, how many times you breathe per minute. They do know how many times the heart beats, but not the respiration rate. So we can see that we breathe more or less 20 times per minute on average. A respiration is you breathe in and you breathe out. So during 1 hour, we'll breathe about 1,200 times. And say we are awake on average 16 times a day. So we'll breathe about 19,200 times. So we'll just say 20,000 to make it easier. So if you breathe right, you do it 20,000 times. If you breathe wrong, you do it 20,000 times. And every time you're lifting your shoulders and your chest, you're doing it 20,000 times in a single day. So if at the end of the day you get pain, tension in your neck and shoulders, it shouldn't really be surprising. Using only the top part of the lungs to breathe really means that if you're using only the top part of your lungs to breathe, it means that the lower part stays still and dormant. Therefore, dust and toxins will tend to accumulate in the bottom parts. So for 16 hours during the day, these parts do not move at all when you're chest breathing. And this makes an ideal environment for microbes to thrive because they like stale air and dirt. And with the COVID-19 nowadays, of course, they're going to be stuck there. So if they do get in, they won't have a chance to come out because we are not moving this part. Due to gravity, everything will fall at the bottom. Moreover, the amount of air inhaled during chest breathing is minimal because the lungs are narrower at the top. They're wider at the bottom, narrower at the top. So consequently, our breathing is shallow and rapid. And it's very easy to become short of breath when we get upset or stressed. And many people end up with anxiety and panic attacks. And they say, I can't breathe. When we refer to air, we really mean the content of oxygen in the air. And it's about 20%, 1/5. Oxygen, of course, everybody knows is so vital for our survival. So the difference of air inhaled, if you chest breathe, you breathe in about 170 mL of air per minute per breath. This works out as 35 mL of oxygen. If you breathe with your abdomen, you take in 500, equivalent to 100 mL of oxygen. Now, we've said before that we breathe about 20,000 times in a day. So, a chest breather will bring in 700,000 mL of oxygen, and an abdominal breather will bring in about 2 million mL of oxygen, which converts to 700 liters of oxygen against 2,000 liters. So that makes a deficit of 13,000 liters per day. Now, common sense would tell us that a body and a brain which receives, on average, 700 liters of oxygen per day is going to function very differently from someone who is receiving 1,000, 2,000 liters of oxygen a day. That's why most people find it a struggle to go through the daily chores and find it difficult also to react to any unexpected circumstances. So it's really not surprising that as we grow older, we end up with many chronic diseases. This is simply because our vital organs have been deprived of a good source of oxygen for very, very many years. If we do not know how to take advantage of the natural oxygen present in the atmosphere, it's very unlikely that we will do so when we require artificial oxygen. If you have ever attended the accident and emergency department or been with someone, you may have noticed that the first action health professionals usually take is to place a mask over your face to give you oxygen. Not knowing how to breathe abdominally or correctly, you're not going to make full use of artificial oxygen. And that may slow down your recuperation and even cause your demise. It is estimated that 3 million people in the UK suffer from COAD or COPD, asthma, and learning to breathe abdominally will help them obtain better results from the therapy they receive via their respiratory tract. What is abdominal breathing then? To understand abdominal breathing, we need to look at the diaphragm. The diaphragm is a muscle which separates the chest from the abdomen. So what should happen in abdominal breathing is that this is the normal shape of the diaphragm, what should happen is you should lower the diaphragm. And as you lower the diaphragm, it creates space around here for the lungs to expand. Can you see how it expands at the lower part, not the top part? Abdominal breathing is natural. It's how Mother Nature intends us to breathe. And when you breathe abdominally, you do not feel any tension within your chest. So, filling your lungs should really be like blowing up into a balloon. So if I'm going to try and take a deep breath and observe the top of my shoulders, the shoulders and the top of my breath, hopefully it should go up. So that's how your lungs should look if you breathe correctly. You should fill up from the bottom, and as you breathe, go up. And if you take a deep abdominal breath, it goes up and up. We don't start from the top side. So, if you were to look up in any anatomy or physiology book, you will see that it describes abdominal breathing like I've just done so. Of course, doctors and nurses have studied the respiratory system, but it's just that theory is not being put into practice. If doctors and nurses were to learn how to abdominal breathe, they would be less stressed and also be able to cope better with their jobs especially under the current situation with the COVID-19. Besides, they will be in a position to teach their COVID-19 patients and others how to use their lungs effectively, and these patients will recover quicker. The effects of abdominal breathing, when done right, can be felt straight away, because I've seen many people talk about abdominal breathing and then proceed to show chest breathing. The good news is when we lie down to relax or go to sleep, we breathe abdominally, or we should. So that should help us to consciously relearn how to breathe abdominally. At least we can try and do so a few times during the course of a day. With patience, perseverance, we can succeed. The next video will be a practical session on respiration, so you can actually relearn to breathe abdominally. Remember, try to breathe through your nose and with your abdomen as many times as you can, and not with your mouth and your chest. Please share with as many people as you can, because you could save lives. And subscribe. Goodbye for now.